Hey guys, it's Marissa. I'm finally filming an update about my 2 brain tumors and my health overall. For those of you who are new to my channel, in March of 2016 I was diagnosed with 2 brain tumors, one in my pituitary and another in my pineal gland. And I also have a connective tissue disorder called Ehlers-Danlos Syndrome and autoimmune issues. My last update was posted in September of 2017, so I am going to update you guys on what has happened to my health since then. In December of 2017, I had a hysterectomy due to complications from my connective tissue disorder. I also got a hernia repaired during that surgery, also from my connective tissue disorder. I am sad that I can't have kids in like the normal way, but I know when I am ready a very long time from now to get married and have kids, that adoption is a great option, and I'm just kind of trusting that everything will work out and everything happens for a reason. So in April of 2018, my mom found out she had uterine cancer, and I just want to advocate that you should always listen to your gut. My mom had literally the tiniest amount of blood one time, and she saw a doctor and they're like, oh, it's fine, it's no big deal. But her gut told her that that wasn't the case, that something was wrong. So she went to a second doctor who did tests and then diagnosed her with uterine cancer. So it was really lucky that she had that gut feeling and then listened to it, because by the time she was diagnosed, she already had stage 2 out of 3, or I guess grade 2 out of 3. I'm sorry. She had stage 1, but the tumor was a grade 2 out of 3. And the higher the grade of tumor, the more aggressive the cancer is. So anyways, the point being, I always recommend, if you are diagnosed with cancer or think you may have cancer, to get a second opinion on the diagnosis or treatment options. And in terms of my mom, she had surgery and radiation, and she's doing well now. She has no signs of cancer, so I think she'll be good. Then a month after that, our dog was diagnosed with a rare 7-centimeter heart cancer. They told us he only had a month to live, which was really devastating because my mom was going through cancer treatment at the time. But he ended up proving all the vets wrong, which is really amazing. He ended up living 7 months. So that really makes me so happy that he got to live so much longer than we thought we would have him. But at the same time, I still miss him a lot. Then from July to September of 2018, I was getting physical therapy and occupational therapy to help me be able to get off chairs and off the toilet by myself, because I was having trouble with that because my hips were weak. The muscles had wasted away from taking oral steroids for my brain tumor and then my autoimmune issues. But I am really grateful that the PT and OT ended up working, and I am so happy to say I can get off the toilet and out of a chair again on my own. And it's so crazy, you don't appreciate things like that until you're not able to do it anymore. So anyways, the bottom line is I'm really happy that I have that part of my independence back. Also in September, I had to get another spinal tap and MRIs of my whole brain and spine, which was really hard for me because the first spinal tap I had a couple years ago was really traumatic. It was like a 3-hour long thing, and the person who did it didn't know what they were doing at all, so I was terrified to need another spinal tap. But it was amazing because I didn't even feel this one. They used x-ray guidance, and so they got it really quick and it didn't hurt. So that went well, and my results were good with that, so that was good. But my brain MRI revealed that my pituitary tumor had come back again. The original plan was to have brain surgery to remove it, but on the follow-up MRI prior to scheduling a surgery, they decided the tumor was too diffuse to be able to safely remove it without impacting the rest of my pituitary function, That meant the only option left was for me to take my targeted therapy pills that I had been on previously again. So I started treatment with my targeted therapy medicine in November of 2018 and will be taking the medicine once a week for 2 years, which that kind of sucks because, to be honest, it sounds crazy, but I would have rather had brain surgery because they take it out and you have 6 weeks of recovery and you're all good and they don't recur at a very high rate. But the targeted therapy medicine I have to take makes me feel really sick for 2 to 3 days afterwards, and I have to take it once a week for the next 2 years, which is disappointing, but at the same time, I'm also really grateful that it wasn't any worse and that I'm not gonna die from my brain tumor or anything, hopefully. So I'm grateful, even though it's gonna be a little rough. In addition, my tumor in my pineal gland, which is the one that could potentially kill me, it hasn't grown at all since I was diagnosed 3 years ago, which is really good news because with that tumor, the only treatment option is surgery, and that surgery is really dangerous and has a really high risk of death or some other kind of disability as a result of the surgery. But at this point, I'm good, and I'm really grateful for that too. But at the same time, if I think about it, it really scares me sometimes thinking about maybe needing that surgery someday if it grows. But I just try to tell myself, not to think about it, and that I have a good surgical team if that ever were to happen, and to just trust that everything will be okay. So that's the update on my brain tumors. So I have been developing other tumors as well. So I had surgery for a benign blood vessel tumor on my shoulder, and then another benign tumor on my back. And then I also was diagnosed with a bone tumor in my left femur in March of this year. It is either a benign endochondroma or a low-grade cancer called a chondrosarcoma. And I'm not really scared of it being cancer, to be honest, because it has a really high survival rate, and all you need to do is have bone surgery and then you're good to go. So it's not really that big a deal in the grand scheme of things. And the bottom line is I need to have follow-up imaging over time to see if the tumor grows or starts destroying the surrounding bone. But even if the tumor right now is a benign endochondroma, it can turn into the cancerous version of the chondrosarcoma. But again, I'm not going to worry about it too much because I know I'll be okay and I'm strong enough to get through whatever I have to get through. So in terms of autoimmune issues, I started Remicade infusions in January, and my treatment plan isn't totally effective yet. I still get flares 2 to 3 weeks before I'm due for an infusion, which is usually given every 8 weeks. My doctor is planning on adding a low-dose chemotherapy pill called methotrexate to my Remicade regimen to try and help prevent those flares, as well as prevent my immune system from creating a, antibody type reaction to the Remicade. I don't really know exactly how to describe it, but anyways, I'm going to be taking a low-dose chemotherapy pills soon. In terms of more surgeries, in March of this year, I had another abdominal surgery for extensive adhesions and endometriosis. And then I found out that I developed a hernia on one of my surgical sites again, so I'm going to have to get that repaired again. So that will be another surgery, and they're also thinking my gallbladder might need to be removed too, so I possibly have 2 more abdominal surgeries I need to do, but we will see about that. Then in April, I had a septoplasty and turbinate reduction again because my first septoplasty failed. So that wasn't fun to have to redo that surgery, but I think it went better than the last one, with the exception of, I think about a week after surgery, I developed pneumonia and was in the hospital for a day getting IV antibiotics, and then When I got out of the hospital, I was getting antibiotic shots for a week, but I'm okay now. My pneumonia is gone, so that's all good. So in June of this year, I started feeling really fatigued and short of breath, along with a lot of other symptoms for several months. It had just kind of been getting worse and worse and worse. So I ended up needing another iron infusion because I was anemic and low on iron again. And I also am getting a bone marrow biopsy in the next couple weeks to try and see if I have some type of cancer originating in my bone marrow. So my doctors think I have a mast cell type disease, and there are 3 types of these mast cell diseases. 2 of the types are seen in a bone marrow biopsy. So either they're going to see one of the 2 types, or by process of elimination, I will be diagnosed with the 3rd type. One of the types is technically a cancer that originates in the bone marrow, which I didn't really think was a big deal at first, because I was like, well, if it's, cancer, they can just, give me chemo and I'll be good. But then for some reason I decided to go on the internet and saw that the survival rate for that is only 6 months, which totally terrified me at first. And I was like, oh my God, I'm gonna die. And then I realized that, obviously I probably don't have the bone marrow cancer, I hope. But even if I do, and I only have 6 months to live, which is the average survival rate with that, I think it's better for me not to be so focused on being terrified of dying, and instead focus on appreciating every moment and appreciating every little thing. And I think that is really important to do, whether you have a day to live or 80 years to live, because it's just really good to not overlook all the little things in life that we so often take for granted. So, with all of that being said, I had to take a break from school because of my health, but I am lucky because I have a very supportive family to help me. I'm trying to stay positive, but I honestly get really frustrated with myself right now, because all I want to do is be a normal college student, and I can't right now. But yeah, it's just really been hard for me lately, seeing other college students and people my age, living their best life and everything, and I feel like I'm missing out on so much. But like I said, I'm trying to stay positive and hopeful that this is just a bad season, and that there is more of a purpose to my life, and I will find what I'm supposed to do and where I'm supposed to go in time.